Welcome to the What's Happening Birmingham video podcast.
Hello everyone, this is Jarvis S. Scott with What's Happening Birmingham. Today I have the honor and pleasure. Been trying to get you on podcast for some time.
And look at here I am.
Yes. For people who don't know, good friend, fellow entrepreneur, Dr. Mia Cowan of Mibella Wellness Center.
Yeah.
Dr. Cowan, thank you for inviting me to your office today.
Okay, thank you for coming.
Great. We are here and our office is located off of 280 in Greystone. Somewhat Greystone, you want to call it
Greystone.
Greystone. So, I wanted to bring Dr. Cowan on today to talk about her entrepreneur journey, but also she has a great upcoming event that's called the Foreplay.
Mm-hmm.
Woo!
Ageless Vitality.
Yes. So that's a provocative title, but we're gonna get into that for a moment. Before we start, Dr. Cowan, kind of tell people kind of like your entrepreneurial background, your story.
Okay. So I am from Birmingham, Alabama, born and raised, and when I initially finished my training in Milwaukee, Wisconsin, I moved back home, worked at Cooper Green Hospital, served the indigent population of Jefferson County, and then I had already planned to start a practice at some point.
Mm-hmm.
So I went and got my MBA from Auburn. They had a specific physician's executive MBA, and I started working on that in 2008, finished in 2010, and then I opened my practice in November of 2010.
Now that's interesting. Most time people, they went to medical school, be like, I can't take no more school.
Mm-hmm.
But you decided to get the MBA aspect. Why?
Right, because I knew I didn't work well for others, and the one thing they don't teach us in medical school is business.
Okay.
So I knew if I wanted to open a practice and run a successful practice, which is very challenging, that I should get an MBA. That's what I thought anyway, that an MBA would help me to get this practice started. And it actually did, because I actually built the practice, came up with the name, came up with the design of the practice while getting my MBA.
Okay, so before we dive a little deeper, so Mibella, what does that mean?
It means my beautiful.
Oh, wow.
And if you can see, it's me, that's M-I, and the last letter is A, so I'm the beginning and the end, but it actually means my beautiful.
Is that Spanish?
I think it's Italian.
Oh, wow, okay. So, you got started doing this, but one thing I always loved about what you do, you have a very concentrated area that you focus on. I like the word wellness.
Yes, total wellness. So understanding that people need to be taught how to live a life of wellness if you want to age well, and if you want to continue to experience everlasting intimacy. It's very important that you live a life of wellness, and nobody's taught anybody how to do that. So that's what I do at Mibella. I get to teach men and women how to live their best lives as they continue to age and maneuver through the different stages of life.
Okay, so I always like to kind of go into people, the viewer. Let's just say I guess don't look like it. I am a mid-40s man. What are some of the changes? Yeah.
Okay, good. That's a good question. So for men in the mid-40s, they may start to notice that they get a little bit more belly. They may notice changes in their desire for physical intimacy. It can start to decline. They also can notice more fatigue, more joint pain, problems with sleep, decreased desire, decreased focus and memory, kind of that adult ADD. And then if they were already having problems with mental health like anxiety or depression, they may notice that it worsens at that age, because that's the age for men where the testosterone starts to decline. And with the decline in testosterone, men will notice those symptoms.
Okay, let's just say I am a woman in my 40s watching this podcast.
And I would even go as far as to say in your mid to late 30s for women is when we have what we call perimenopause. So that's when you're still possibly having cycles, you're still producing estrogen, but that's when the testosterone declines for women. And women will start to notice the night sweats, the problems with sleep, the decreased desire, the decreased enjoyment, the joint pain, the fatigue, the belly fat, the mood changes, and the mind fog. So really the symptoms are pretty similar for both men and women as far as low testosterone goes.
Okay, so I'm going to go into like the business students, like business class. When you first started thinking this business, who is like your target market with this?
Okay, good question. So it was when I first started my business, it was strictly for women. It was gynecology and weight management.
Okay.
So I still thought of women. My primary market was in the 30s to 60s, but I take care of women and adolescents. So I have my young ladies when they first start their cycles, all the way through the different stages of life until they're until their 70s and 80s. So my focus was focusing on wellness, and so that's what, and not doing OB anymore. So I stopped delivering babies once I started the practice. So that brought in a lot of women who were done with childbearing, and I started seeing a lot of them with the same problems. The inability to control their weight, the weight gain in the belly, the not being able to sleep, the changes in their relationships at work with their significant others because of all of these hormonal changes. So that's what really got me into the hormone balance, because nobody was talking about testosterone. So I started doing the testosterone pellets here in Birmingham over 10 years ago.
Okay.
And I was probably one of the first gynecologists here to do it. And when I brought that into my practice, I started treating women with testosterone, and I call it the forgotten female hormone, because whenever you think of testosterone, you think of men. But women do produce estrogen, progesterone, and testosterone. Men produce all of them too, but just at a much lower quantity for the estrogen and the progesterone. So I started treating the women. They were feeling better. Their desire for intimacy increased. They were feeling good. And the men were having some of those same issues, and it was very obvious once they felt better. So they started bringing their husbands. So now I take care of women and men for hormone balance, intimacy services. So even outside of just hormones, men and women start to notice a change in their function for intimacy. And with that, we have some great procedures for both men and women to make sure that you can have everlasting intimacy. We also do laser hair removal. That's a part of menopause. You start getting more acne and facial hair. And then we also really focus on weight management, because that is the most preventable cause of death. It used to be smoking, and now it's become obesity. So by helping somebody maintain a healthy weight, we can help them live a healthy life.
And some of the trends I've been noticing lately, when it comes to health, sometimes people want a jack-in-the-box type of approach.
Yeah, they just want a fast
jack-in-the-box.
fix.
They come in, they take the, I hope I'm not trying to give them free promo, of the OZ shot, the Wegovy shot, and
those are good medications.
But
they got to be used correctly.
Used correctly, but I like how you come in from an approach saying mental, that you got to get, because a lot of this stuff is all mental in the head before you even think about you want to go get something to eat. You think about want to get something to eat first.
And if you're irritable and anxious and depressed, you really think about food all the time. And you want something salty, and then you want something sweet, so you start gaining the weight because you're more anxious or depressed or irritable, and the first thing a lot of Americans go to is food to make us feel better.
Yeah, and the foods are actually, I've heard someone makes you depressed, because some foods you eat because they have you slow, drowsy.
Yep, all the sugar and the caffeine, you get those highs and lows, and you feel worse afterwards, even though you feel good for about 15 or 20 minutes, with the increase. But if you're balanced, if you're taking the right supplements, if you're exercising, eating a healthy diet, and your hormones are balanced, it makes it much easier for you to feel good as you continue to age.
Because another thing I like about your approach is a lot of times, say for instance, we do our annual visits with our doctor. They sit down, they start asking us questions. Some doctors, not gonna say all of them, they'll just prescribe you some pills. If a man's not, rising to the occasion, they'll just pop a pill.
Right.
Take this.
Right. And we want to figure out why.
Yeah. So it's like delving, pulling I would say rip the Band-Aid off and figure out what's going on down there.
And really the main problem is, hormonal imbalance. So what happens is a lot of women will start not sleeping at night, so their doctor gives them a medicine for sleep. They start having the night sweats, and then they give them an antidepressant because their mood is off. They're gaining weight, so now they're on weight loss medication, something to sleep, something to help with their energy. They can't focus and remember, so now they're on ADD medicine. When in actuality, all they needed was hormonal balance, and that could have given them the testosterone, the plant-based bioidentical testosterone, that would help with all of those symptoms, keep them off all of the extra meds that can cause other side effects, and fix, like you said, the real problem, not putting a Band-Aid on the problem, but fixing the problem. If the testosterone is low, increase the testosterone to the right level for that person so that they can feel good and get rid of those symptoms.
So how has the trends changed over the years with treating these specific
Question, Jarvis. Look at you.
Yeah.
So, women were afraid of hormones for a while. So
Okay.
back in 2000, they did this big study. They call it the Women's Health Initiative
Okay.
study. And in that study, that's when women were taking estrogen and progesterone. They were not even taking the testosterone. And they were taking the synthetic made from horse urine that you write a prescription for. And a lot of those women were noted to have an increased risk of heart disease, stroke, blood clots, and breast cancer.
Okay.
That study showed those numbers, but once they went back and reviewed the study, they realized that it was a little exaggerated.
Okay.
The risks weren't as high as they thought they were. So what they did was they told all women, just get off hormones.
Okay.
So all of these women who had been feeling better with hormones, they just yanked them off and let them suffer through. And so I went and did the research because I realized that what I was taught in medical school and residency just wasn't working. Like if my patients were feeling bad with all of these symptoms, giving them estrogen and progesterone didn't help. It was really that testosterone. So I went to figure out what could help my patients. I learned about testosterone, the plant-based bioidentical, and I started using the cream forms. And then I found a great company that I was trained with to do the plant-based bioidentical hormone pellets. And they work so much better. They're long acting. People feel better. They decrease the risk of heart disease, decrease the risk of breast cancer. Testosterone pellets do decrease the risk of dementia as well as bone loss. So they actually help improve health as well as quality of life.
And I know women are watching. Why this man want to know so much about it? Well, you want to know this so you won't think it's you. It's something going on with them.
That's right.
Now, even with the man, you know, I guess I get real.
But men get irritable too. They go through that whole little andropause.
Yes. They get irritable. And then what I was thinking while you was talking about all day is sometimes men, they'll pop the blue pill, and the blue pill have all those side effects
That's
too,
right.
where they have a headache.
Their heart, it can affect their heart,
yeah.
and it can make it where they can't get rid of what they were trying to get. So instead of the blue pill, most of my male patients, first of all, we check their hormone levels, make sure they're balanced. If they're not, we give them the plant-based bioidentical testosterone, get their levels up, they're feeling better. And then if they're still having function issues, because 50% of men at 50 are going to notice a change in their erections. That's just a part of life. The same way women are going to notice a change in their vaginal tissue. They're going to notice more dryness. So we can fix that with our intimacy services. So we have the P shot for men, the O shot for women. We have a wave machine that increases the blood flow, improves erections for men, improves sensitivity, enjoyment, the big O for everybody. And then for women, it even helps with urinary symptoms that a lot of women notice as they continue to age and mature, like leakage of urine or more urinary tract infections.
Now, forgive me, but I know a couple of years ago you asked me about this type of service you do. I'm gonna call it, instead of saying the V word, you renovate the house.
Yes, and that's what the O shot does.
Okay,
so the O shot is
okay.
like rejuvenation of the vajayjay.
Yeah.
And what that does is, as women age, they notice more dryness because of the hormonal changes. But they also notice a change in the tissue where the vaginal tissue becomes thinner. It's not as sensitive. It can be uncomfortable to have intercourse, and it can be very difficult to enjoy intercourse like they did before. So by doing the O shot, once every 12 to 18 months, that keeps the tissue healthy, lubricated, and orgasmic.
So they don't have to go buy all that jelly from the stuff.
Yeah, we don't do that. And then I also teach my ladies to treat the tissue before it's a problem. So now if you're 40, I recommend you do put something in vaginally twice a week to decrease the chance of what I call old lady vajayjay. We're not doing that at Nibella. We treat the tissue, maintain healthy tissue just like we do with our face. You have to give it some extra attention as you age to get rid of the wrinkles. You have to do the same thing for the vaginal area. And then for men, we have those same wonderful services so that they don't have to suffer through erectile dissatisfaction.
Because like I know some women probably watching this too. I just had that kid. Does that
Yes.
Okay.
So after having a baby, they may notice a change in the laxity of the tissue, so it may not be as tight as before, and they may notice more leakage of urine with coughing, sneezing, jumping, laughing, or urgency and frequency. So those procedures will get rid of those symptoms and still improve their function and enjoyment.
So what's the average? I know sit down for initial consultation. Once you start the treatments, I know some people probably come for ongoing treatments, but is it normal like 3 to 6 months normal?
Good question. So for the pellets, usually for women, they're going to get their pellets every 3 to 4 months. For men, they're going to need their pellets every 5 to 6 months. So the pellets last for a while. A lot of the intimacy services for the men, it depends on what's going on. So a man who's had prostate cancer, had his prostate removed, we can still do those services to help him to continue to be able to enjoy intimacy. So he's going to need more procedures than somebody who's just turning 48, 49, noticing some small changes, and they want to do procedures to make sure that they don't go down that road at all with erectile dissatisfaction. So it's going to be individualized treatment for the pellets as well as the intimacy services, and even our weight management and gynecology. We try to individualize treatment so that everybody gets exactly what they need based on them and their genetics and their lifestyle.
Do you offer meal plan suggestions?
Yeah, so with our weight management, we separate ourselves because we were all trained on weight management. So me and my nurse practitioner who does the weight management here, we went through the Center for Medical Weight Loss so we can learn how to teach our patients to really lose the weight the right way. So they come in, do a consult, they come in fasting, breathing a machine, and then it tells me your resting metabolic rate. So I know your resting metabolic rate is, for example, 2,200. That means that if you eat 2,200 calories every day, you will not gain weight. If you eat 2,000 calories every day, you're going to lose weight. And then it helps us with your eating plan to design one. And everybody is pretty similar. You're going to need your healthy protein because over 35, you're fighting for that muscle. So you need healthy protein. You need good resistance training. You need your cardio activity. And you need to eat healthy food and frequent small meals instead of eating 1 or 2 big meals a day.
Now, one thing that just came in my head is, do you do supplements, vitamins?
Yeah, so we have a supplement line. I love our supplement line. And I started this supplement line because I had patients who needed supplements, and I would say, well, go get omega-3 or go get this, and they would just go to Walmart, grab it off the shelf, and it was a lot of fillers in there, and it wasn't necessarily the products that I needed in there to really supplement their nutrition. So with this line, it was made by naturopathic doctors. It's called Ageless Balance with Dr. Mia. So I know they're getting high quality supplements that have been tested and verified, and they're safe and effective, and a lot of them are actually vegan, so my vegans can do the supplements and not be worried about having some kind of form of meat or animal product.
Now, I'm glad you brought that up. So when they bring those hamburgers, the plant-based hamburger, are those healthy to eat? In your professional opinion?
I'm not into a lot of processed food. I believe that God put on the earth what we should eat. So I like my lean protein. I like my fruits and vegetables, and I try to eat as much whole food as possible, and I find that works best. I think when you get into a lot of processed food, they're putting some extra stuff in there and you don't quite know what it is. So you would really have to verify the ingredients. But for me, I just like to eat the regular food that God put on the earth, including the animals. But some people want to avoid that, so they do have to come up with creative ways to get the protein in for the muscle mass.
So is that the difference between coconut milk and real milk?
It is.
So cow milk.
Yeah, so cow milk is dairy.
Okay.
And so some people like to avoid dairy. They feel like it increases mucus and that dairy is no longer healthy. I personally am lactose intolerant, so I do a lot of almond milk or oat milk if I'm going to do milk. I can't do regular milk, and a lot of people can't. But I think, and then if I cook, I'll still get regular milk to cook with. I just try to get the organic, like I try to get the organic meats because I feel like they're healthier and they don't upset my stomach as much. They're not as processed, and I actually stay full longer when I eat healthy, lean protein, high quality, organic. I don't have to eat as much of it to be satisfied and full compared to if I go to a fast food restaurant. I'm going to be hungry in 2 or 3 hours.
Okay, and a lot of these questions, like I said, sitting there, if somebody's watching this right now, what's one thing they need to get out of the refrigerator?
I know that's processed stuff.
Processed
stuff. But they need most of the stuff in the refrigerator, your fruits and your vegetables and your lean protein, You can eat the foods that you enjoy and just try to minimize the processed foods.
Okay. So let me get into the lead way into the foreplay.
The foreplay.
So this is going on March the 15th.
March 15th. We are super excited. Starting at 9 o'clock in the morning. It'll end around 3. It's at the UAB Hilton.
Okay.
And we're super excited about that. That's a great venue. The women are going to have a great time. This one is for women only.
Okay.
We do plan on in the future having one for men, women, and couples. But this one is for women only, and we're going to focus on intimacy. We're going to focus on wellness. We're going to talk about menopause and weight management. We're going to talk about supplements, and we're going to teach women how to live their best lives. And we're going to put an emphasis on focusing on everlasting intimacy, a conversation that we don't get to have a lot as far as women go. We don't talk about intimacy for women as we continue to age. So that'll be a big part of the conversation, along with all the healthy things we need to do to continue to have intimacy as we age.
So who are some of the speakers you got?
Oh, I have some amazing speakers. Some of our local ones. I have Dr. Cree, who is a family practice doctor, and she is amazing. I also have Dr. Leisha Ellis-Cox, who is a psychiatrist. I have some people coming from out of town, Dr. Michelle, who is a mindset coach and physician. I also have Dr. Tracy, who is one of the few burn surgeons in the country, especially female, especially black female. And she'll be coming to do some moderating because she knows a lot about skin and all of those things. She knows a lot about everything. She's just brilliant. Then we also have Miss V, who's going to MC for us. She's going to host the event. Who else do we have? I know I'm missing some people.
Pick somebody named Peggy?
Oh yeah, Coach Peggy. How did I forget her? My trainer. So she's gonna come and do some demos. So that we know.
PK Fitness?
Yeah, PK Fitness. One of my favorite trainer in the whole wide world. But yeah, she's gonna come and do a demo at the beginning. It's gonna be a lot of fun. It's gonna be very interesting. We're gonna learn a lot. And I have Dr. Javara, who is an intimacy expert. So she did the passion parties and the passion toys. So she's gonna teach us a lot about those things. So this is gonna be for intimacy for women who have a partner and who don't have a partner. And the importance of it for their total wellness and living a healthy lifestyle.
Well, I like the title of the event. I mean, it's the foreplay.
Right.
Before you can do anything else, gotta have the foreplay.
That's right.
And then you got the foretaste, which is another thing too. That's very interesting topic.
Right. We'll have some good food when they first get there. Yeah, the foretaste. That's that.
So I gotta ask. I should have asked when I was doing going into the biography. So who was a doctor that inspired you to be a doctor? You know how they always say, since we're in Black History Month, we got to see it before we can be it.
I think that's a good question. So when I was at Ramsey, so I always said I was going to be a doctor. I think I told my mom I wanted to be a nurse because she was a nurse. And she was like, oh, Mia, you're smart. You can be a doctor because you're good at math and science. So then from there on, I started saying I wanted to be a doctor. But then when I was at Ramsey High School, a black female physician, that was the first time I had ever seen a black female physician. And when she came, I knew for a fact that I could be a doctor. I was like, okay, I see one, I can do it, I see it, I can make this happen. So that was the first person that inspired me, and I don't even know her name. But it was a black female physician that came on a career day, and it let me know that that was possible for me.
Oh, wow. So where can they go if they want to purchase tickets?
So we're going to have a link here that they can just go click the link, and they can go ahead and purchase their tickets for the first couple of weeks. They're going to be on sale, early bird tickets, so it's a good time to get your tickets while they're $50 off. We have general admission, and we also have a VIP component to it as well, where they'll get some other gifts, they'll get a consult afterwards, and some other goodies so that they can enjoy the event even more.
Okay, so give them the address. Where you're located? It's
going to be where I'm here?
Yeah, right now.
Okay, so I'm at 2807 Greystone Commercial Boulevard. Just Google Dr. Mia or me, Bella. I'll come right up. Easy to find, right behind the Panera. And then the event again is at the UAB Hilton downtown. So we're super excited about that as well.
And I must ask, if somebody's thinking about doing a consultation, can they book with you direct, or do they need, need a referral from the doctor?
They do not. They just go to mebellawellness.com and they can book for gynecology, or they can book for one of our other services like the hormone pellet therapy, the weight management, the laser hair removal, the intimacy services, and the total wellness with supplements.
Okay, I guess I always think with the viewer. Now, is this something that sometimes health insurance covers, or is this optional sometimes? Health insurance covers
gynecology.
All right.
Some people's health insurance will indirectly cover the pellets, the weight management, the intimacy services through their flex spending or their HSA account. They can use it that way, but for the most part, that's going to be out of pocket. So, I think we all have to understand the importance of investing in our health, time-wise as well as money-wise, because either you're going to pay now or you're going to pay later. So if you don't lose the weight, your medicines are going to be expensive. You're going to be at the doctor's office all the time because of the diabetes, the high blood pressure, and the heart disease. So here we say invest up front in yourself so that we can prevent all those things and you can live your best life.
Yeah, because I'm thinking like after a while you do all those, them co-pays start adding up.
They
after
do,
a while.
especially if you have something like diabetes, high blood pressure, heart disease. You're seeing the doctor every 2 to 3 months, and sometimes sooner than that once they're figuring out all of your meds. So let's just do the prevention part. Go see your doctors, do your screenings, maintain a healthy weight, and learn how to live a healthy lifestyle. And that's what I'm here for, to teach you how to live your best life through total wellness.
Yeah, and the thing about it too, I'll just say even for the men or even for the women, it's like once you start doing the research behind some of these pills you take, whether it's blood pressure pill or the blue pill, and you think about all these ingredients that's in it.
Yeah, they fix one thing, but then they have 10,000 other things that they can cause. So the best thing to do is treat the real problem and do the things that we can do to prevent disease.
Okay, well, Dr. Cowan, thank you for coming on today. Enjoy this conversation.
Me too.
We got to get in the weeds. I think there's so many different little mini segments we can go into.
That's right. But they just need to come to the conference and they'll get to hit on everything.
Yes, and if you're a guy, there won't be a conference, but they're going to do a conference in the future.
Not this time.
Shout out for your husband, Joseph.
Yeah, Joseph. So Joseph is our male intimacy coach.
Okay.
And so he is the person that I do all of my male stuff on. He is the guinea pig. So whatever new procedure I have, we try it on Joseph first, make sure it's safe for everybody else, and make sure it's effective and it works. But he's really good at making men comfortable with these conversations, because they're not conversations that a lot of people are comfortable with: intimacy, aging, hormone balance. So he makes that comfortable for the men, just like we make it comfortable for the women.
So do a lot of couples come together for
a lot of couples. That's my favorite, because it's like you fix one person and you don't fix the other one, the household still isn't balanced.
Oh yeah.
So everybody needs a little fixing once they're over 35, 40, 45, 50. So I really enjoy my couples, because one of our ministries is marriage. So we are really into marriage, and we know that it's important to live a healthy lifestyle so you can have a great marriage and everlasting intimacy.
But you know that I took from this interview, sometimes just the house analogy, sometimes you just need to renovate the house. You just can't slap some paint on it and expect it to just get renovated.
Yeah, sometimes you got to fix that foundation.
Yeah, clean the gutters and everything,
all the things.
So that works.
The gutters, okay.
So thank you all for watching. Please check out what'shappenedbirmingham.com for more interviews. Check out the audio version of this on Apple Podcasts. I am on TikTok, everybody, however long it lasts. And just subscribe to the YouTube channel. I may have mentioned that before, but Dr. Cowan, thank you. And tell them that website right before we go.
MeBellaWellness.com, or it's Dr. Mia.
All right.
Google Dr. Mia.
And how they follow you on Instagram and IG?
Dr. Mia Cowan MD, Mia Cowan MD, or Me Bella.
All right, well, thank you all.
And go on the website. All of them are on there. You can just click on the link and join our pages so you can get all this great health information.
Yes, Foreplay, March 15th. The real foreplay.
The real foreplay.
Thank you all. Have a great day. Bye-bye.
Thank you for watching the What's Happening Birmingham video podcast. Please check out our website, app, or subscribe to our YouTube channel for the latest videos today.